One of the things that I had the most fun doing at St. Charles Health System in Bend was when we started looking at the impact in our neonatal intensive care unit. Talk about early intervention. Let's talk about neonatology, right? So we know that children who are born less than 32 weeks or may have other difficulties during their birth are at a higher risk for neurodevelopmental disorders. And many of those neurodevelopmental disorders formulate into things like autism spectrum disorders and other types of challenges that are traditionally seen in the mental health field along with the physical health field. So we put a psychologist into our NICU about 5 years ago who began working with families in that early stage to teach them how to stimulate their children's brains in that very, very most earliest stages right there in the NICU, and what cognitive markers to look at for growth and development. And then we follow those children over the first 5 years of life. So they come in every 3 months, 6 months, year, whatever, until they're 5 years old, where a team of specialists, including the psychologists, sees them to see if we can track and trend early development of neurodevelopmental disorders and other types of things. That type of intervention saves brain. That's what makes a huge difference between a child's early life costs, which can be very expensive, and their lifetime costs, which without intervention could be in the millions. So that's one way we've looked at how we see mental health disorders and the development of that. We put psychologists into our pediatrics clinics about 3 years ago. We've seen a lot of great ability to intervene with ADHD without medication, to intervene with other types of behavioral disorders, because normally parents take their child to the pediatrician, right? That's where we see the bulk of mental health presentation in children. We don't go, oh, wait, my child seems to have some type of a mental health disorder, so I'm going to take them over there to this mental health professional. No, you go to your pediatrician. So why not put mental health where parents are taking their children so we can start to intervene earlier? And then the third thing we've been doing, really will start this fall, with interventions in school-based health centers. I'm really interested in what we can do in the early identification of depression and other difficulties in middle school, right? So if we say to everybody in 7th grade health, you're all going to take this depression screen, or you're all going to have this SBIRT to assess for alcohol and drug, et cetera, and then put providers there in the schools to be able to deal with them, I think we're going to be able to get better early identification and intervention in what is a high-risk population in middle school and early high school before we develop into some of the other types of tragic events that we've seen.